What is up, you guys? My name is Austin Marks, and welcome back to my YouTube channel. So today I have a guest with me. This is Jolie. She is also a respiratory therapist. She's actually a lead respiratory therapist. She's going to kind of share her story with us. So do you want to jump right into it?
Yeah, so like Austin mentioned, my name's Jolie, and I am a lead therapist. So to kind of talk about how I became a therapist in the first place, and then eventually became a lead. So my background is medical. So I was a CNA, EMT, and then eventually, branched out and worked in the lab. So I've kind of just floated all over the medical field until I shadowed a respiratory therapist. And I was actually in the process of applying for RN school when I got the opportunity to shadow, and I decided that was a much better fit for me. And then I became an RT. So here I am, fast forward 3 years, registered respiratory therapist, and I got a great opportunity to apply for a lead position. So I'm very grateful to be there now. And so the reason why I chose respiratory to elaborate on that, because like I mentioned before, I was applying for nursing school, was when you're looking at nursing, you're looking at respiratory. I personally feel like respiratory is more independent, where you come in, you get your assignment, and you just go take care of your patients. So when you're in school and you're learning about respiratory, you're going to learn like a foundation, but you really get to be your own healthcare provider. Like you really get to go in there and assess patients the way you feel is best, versus like when you're in nursing, I feel like everyone's right there. It's less independent. You're always like having to be on the phone with providers. You're always like, all the other nurses are right there on one floor. And another thing that really made me pick respiratory over nursing was you get to go all over the hospital. Like your assignment's never the same. Every day you come is something completely different. And I just really enjoyed that versus like being a unit nurse, like I'm always going to be in ICU, like every single day I come in. But when you're a respiratory therapist, you can come in and have the emergency room. You can have the unit. You can have the post-surgery floor, like SICU. So I really enjoyed that. Every day it could be something different. And you got to really get to know the whole facility and work with all types of different patients versus being just isolated to one designated area.
So that is one thing I love as well, is I feel like I get to go all over the place, and I am kind of my own provider in a way. I don't necessarily have a lead hovering over me all the time. No offense.
That's awesome. Yeah. And so where I work, they didn't actually always have leads, like as a fun fact. That's something they implemented. And I think it's definitely great for night shift because like you and I were both night shift workers. I actually have new grads who work with me, and I can just see like how a new grad really just enjoys having that lead person that they just feel comfortable and they build that relationship with, that they know they can go to and ask me anything. And even if I don't know the answers, that I will come right away without hesitation to partner up with them and figure it out together.
So how old were you when you went to college? Did you go to a 2-year program or did you go to a 4-year program?
So great question, Austin. Not to sound braggy or anything, I'm very fortunate. I knew that I wanted to be in the medical field right when I was in like the 9th grade of high school. So I was very fortunate that my school offered like CNA program, and I was actually one of the first classes due to the EMT dual enrollment. So I actually graduated my CNA, my EMT, and my like almost done my first AA degree. So
Wow.
I just hit the ground running right when I graduated and started working as a CNA and getting my feet wet. So it wasn't until, so I didn't go right into RT school to answer your question. I first worked in the field as like a CNA and EMT and stuff like that. And then again, in the lab, like as a lab technician before I really made that decision. And again, I was going for nursing. I always thought I wanted to be a nurse. So I think it was like maybe a year or two until I made that decision and I started applying to schools and I finally got into a program. So yes, and then I ended up actually doing a 1-year program.
Wow. That's awesome.
Yeah, I was very fortunate. Again, I found a respiratory program that was accelerated. It was a private school. So I attended that. And because I already had that AA degree, it cut it down to like basically 12 months. and the semesters were 10 weeks long. It was very accelerated, and it's not something I recommend for everybody. But I was definitely trying to get it done, and it was really nice. Yeah, so I was in a 1-year program, but the program was 18 months. So you could have went to this private college right out of high school, and they would have provided all the fundamental classes, all the core classes and the prerequisites first. And then you would have started like RT 210, 220, 230, and so on until you graduate in 250. So I had classmates who came in right out of high school and graduated with me. I also had classmates who were, in their late 40s, who had a completely different career. Like I had a friend who was a journalist and did a complete career change, became an RT, and he's extremely successful today practicing respiratory therapy. So you can come from all walks of life, all different backgrounds, already have a degree or come right out of high school and become an RT and be successful.
So yeah, I actually had a classmate who was in their mid 40s as well. So he was an ER tech and then came back to school and decided he wanted to become a respiratory therapist. So how many years have you been a respiratory therapist? Do you have any credentials or anything? And has that helped you become a lead?
Great question, Austin. So I have been a therapist now 3 years, and I don't have any credentials. And I'm sure it definitely would have helped to have credentials. I was just fortunate enough to have already been working and established great rapport at my department whenever I went for a lead position. But if I were applying as a lead somewhere I didn't already currently have that rapport, I think having your credentials would definitely make you more applicable. I do have the Kettering ACCS on audiobook on my phone, and I use it as a go-to reference all the time. So even though I probably could go take the test tomorrow if I wanted to, it's just not something that is pressing on me right now. Some facilities, they actually require it. Like I was actually looking at one time to work in Kentucky. I don't know why. But because they're respiratory practitioners there, where we're just respiratory therapists here. So they actually require you to have your ACCS there to be hired. And I'm sure they have like a rule, like if you get hired and you don't have it, you have like 90 days to get it or something. But so it's very interesting. It's different state to state. Some states require it because you are considered a practitioner, like a specialized role versus a broad.
That is very interesting. How respiratory across the whole United States is just totally different. I know we had some travelers that came from Georgia, and what they practiced, they actually had a little bit more autonomy than what we do up here in Pennsylvania. I'm sure it's different where you are from as well.
Yeah, so it's actually different hospital where I'm from. So I've worked at a facility before where RTs, I felt like ran the world, to be honest. We did everything from intubating, placing A lines, to putting whatever event modes that we wanted that protected us by the policy and protocol and procedure. And we just got a gas after an hour and went handed to provider. And, they just kind of, we would talk with them and see if they want to make any changes. If they had suggestions, but it was pretty much ultimately up to us to do everything. And now at my new facility, the autonomy is a little different. It's kind of funny because I work with the same exact pulmonary team that I did at the other facility. But at this facility, the autonomy is a little different. We just assist in the intubations, and we are working on getting A-line autonomy right now, but we don't have it. And but again, at the other facility, it was go, go, go all the time, like extremely fast paced. And now I'm getting to spend a lot more one-on-one time with my patients at this new facility. And my patient assessment skills, I feel like, have become a lot better. And I spend a lot more time with family and getting to know them as individuals versus just seeing them as patients and taking care of them. So that's nice.
So I get asked this question a lot, and a lot of new respiratory therapists will ask me, hey, should I work at a larger hospital that's fast paced like that, where I can get a lot of experience? Or should I work somewhere where it's a little smaller and I can work my way into respiratory therapy?
That's a great question, Austin. So I feel like it's definitely to each their own. If you do start out working at a smaller hospital that allows you to get more one-on-one time with your patients, it's not as fast paced, it's not a bad place to start, because again, you get to really work on your patient assessment skills. But it's also not a bad idea. Again, I started out, I hit the ground running in a really fast-paced facility where we had a whole bunch of autonomy, and I got loads of experience. And I feel like that made me more confident is someone who's practicing respiratory versus when I speak to my new grads now at my current facility, they love that they started out at a smaller facility again because they've really got to also have time to set into their new role and work on specific things like patient assessment. But they also gives them a chance to figure out what it is they really want to do. Do they want to go work with pediatrics? Do they want to go work, with adults their whole lives? Kind of gives them an opportunity to really think about where they want to go in what direction as a respiratory therapist. But they, again, aren't getting that autonomy and really getting to get that hands-on experience. So they would eventually need to move on to a facility that is fast-paced and has more autonomy, because if you're not using those skills, you're going to lose them. So if you come in as a new grad, you're not really getting to place A-lines or intubate and really utilize those skills that you work so hard to acquire. I just feel like, anybody's going to start feeling maybe discouraged and not as confident as a respiratory therapist. So I highly recommend people go where the autonomy is, especially as a new grad. If not right away, within your first year, you need to get in there and get hands-on.
I agree completely with that. And something that I've noticed as well is sometimes the bigger hospitals aren't always the one that gives the respiratory therapist all the autonomy. Sometimes the smaller hospitals are like, hey, your respiratory therapy, we don't have a lot of staff. You know what you're doing and you have a lot more autonomy. I know some people who work at a smaller hospital and they have the ability to intubate. And I work at a larger hospital and unfortunately I can't do that.
Yeah. So again, it's definitely per hospital, per state, like it can be completely different. And it's crazy. So my facilities are actually right across the street from each other. So I came from a bigger facility where we have more autonomy. And that was because it was a teaching hospital, but it was usually the residents' first year. So they really depended on the respiratory therapist to get the job done because the students were still learning. They weren't to the part where they were really performing that well. They were a little rusty, so they really depended on us to even be educators, which was really awesome. My new facility, we are educators, we still support, but we don't have that hands-on. But I do know circumstances, just like you talked about, where smaller hospitals, actually where I worked at before as a CNA and where I shadowed the RTs, they intubated. They weren't placing A-lines. They didn't really do much A-lines, I don't think, there, but they were doing the intubations and everything. So that was cool.
So let's jump a little bit into you being a lead as a respiratory therapist. So how many years were you a normal respiratory therapist or working on the floors or in the units before you officially became a lead? Or do you still work on the floors or in the units?
So I was a therapist at this facility for a little over a year before I advanced to a lead position. And becoming a lead, my responsibilities definitely adjusted, but I still do take an assignment. So I still do work at the bedside and work with patients. But depending on staffing, because at night, sometimes it can be a little bit more scarce. But if I have like a good number of staffing, then I'll take a little bit of a lighter assignment so I can work on more of the lead responsibilities that I have, because I do get like a good example, like I do get tasks assigned to me by my supervisors, that like little projects that they would like to implement to better our department. So for example, we do something like a count sheet for the census so that we can evenly distribute the assignment fairly based off of like how many treatments there are on that floor, how many events are in that unit, stuff like that, right? So I actually just updated our Excel sheet for our accounts. And with Excel, there's like formulas and stuff like that you gotta really work on. So if I had like really good staffing one night, then I could take a lighter patient assignment so that I could focus on completing that project for them. But if we're kind of having a short night with a few call outs, then I'm gonna be taking an equal amount assignment just like everybody else. Yeah, and on those nights that were shorter, not only do I take a regular assignment, but it's now I have more of a responsibility to make sure I'm going to every other section of the hospital and checking on the staff members, making sure that they're not feeling bogged down and they feel supported, or if they have any questions, I'm there for them. So I probably overcall. I'm like always calling my teammates, asking them if they need anything. And I'm usually the one to like, if someone's going on transport, I'm probably covering their unit while they're gone and just stuff like that. And we also do things as a lead, like as far as like the change from going from staff to lead would be we do things called huddle. So that's something that fell under my responsibility. So when everyone gets done doing reports, I'm going to be looking at the huddle board, making sure that everyone understands the content that's on it. And like, for instance, we just did mandatories, right? Like your mandatory education for the hospital. So that's always on the huddle board, like, oh, you got, 3 days to complete your mandies, stuff like that. And so that kind of falls under me. And also we do equipment tracking. So, because I don't know about you guys, but our equipment's always missing. So that's also a responsibility of the lead, making sure that we have a board and we have a sheet that we try and use to track. So if it's been an insane night, then I'm not going to really require my staff to have that great quality communication, like letting me know where everything is. So I even do an equipment round towards the end of the shift and go look and try and find where everything is. But typically I like to practice with my staff members that they're calling me throughout the shift, letting me know like, hey, like I just set up this vent number, or hey, I just discontinued this vent. And we kind of do it like that. So those are some of the different responsibilities I did not do as staff.
I think that's great that you actually check on your staff, because I've heard horror stories of some managers or leaders just not paying attention to any of their staff or checking on them at all. So that's fantastic. It's a total leadership move right there. So do you plan on staying a lead forever? Do you want to go back to being a regular respiratory therapist, a normal staff, or what are you thinking?
So I really enjoy being a lead therapist, but I definitely think that I would like to move back to days. So if the opportunity arises where I can go to a leadership role or be a team lead on days, then I'm definitely going to make the move. But I do love being a lead therapist on night. I feel like it's really threw me to the wolves when I upgraded to being a lead, because it's just me on night. I don't have like the management to run to if I don't have an answer. So I got to really depend on my leadership skills. And I've learned so much. I feel like in a shorter amount of time being on nights as a lead than I would on days. I probably would be overutilizing my resources on days if I was doing that. But yeah, I would love to stay a lead for as long as I'm a therapist. That'd be awesome.
So being a lead, did you get any pay increases? Because I know your responsibility increased a little bit. Did your schedule change? Do you work weekends, holidays? How does that work for you?
So with becoming a lead, I think with any like promotion type situation, you're going to get, I hope that wherever you work honors that, and they see you're going to be taking on a bigger role and a lot more responsibility. So they will pay you a little bit more, right? Give you the incentive to put in more work and to take on more responsibility. So that's been obviously really nice. But it was also a pay increase for me because I went from actually part-time day shift to full-time night and lead. So overall, it was going to be an increase for me going part-time to full-time and going from days to night, because we get night shift differential. So with scheduling, it's really nice because I'm not the only team lead at night. There's 2 others currently. So we get to just work together. We are very fortunate. We get to do self-scheduling at my facility. So I just work with the other 2 lead therapists, and we have like our own kind of rough draft calendar, and we kind of put what we would like. And we just work around each other. And so when we use the software called Kronos, when Kronos opens and we're doing the self-scheduling, we kind of already know what we're going to put in, and that's how we do it. So we do have a weekend rule where you have to work 4 weekend days or shifts in that pay period. So it doesn't have to be every other weekend. And Friday night also counts for us. So as long as I work, like I could work 4 Friday nights or a Friday, Saturday, or a Friday, Sunday, doesn't matter. As long as I work the 4 weekend shifts in that pay period, then I'm meeting their expectations.
So being a lead, I'm sure that looks fantastic on your resume. Has that opened any other doors for you, or are you thinking about any other things in your life, such as careers?
So yeah, becoming a lead therapist definitely did open up more opportunities for me, I think, because it's obviously going to look really good on my resume, and it shows that I take initiative and I don't mind taking on more responsibility or taking leadership roles. But I definitely don't plan on being an RT forever or an RT lead. I'm actually 6 classes away from finishing my bachelor's in health science. And then I plan on applying for AA school. So AA school stands for anesthesiologist assistant. And they typically work in the OR, with anesthesiologists. But my friends who are actually already AAs, they work in other facilities that hire AAs at night, and they actually do like the emergency intubations and stay on staff if there's any issues and they need airway management or A lines placed, which I thought was cool to find out. And AAs can also work in dental offices for those dental surgeries. They can also work with plastic surgeons and help with their procedures as well. So there's a couple different routes you can take as an AA. So I'm excited about that. But becoming a team lead at my facility, I feel like, because I actually want to become an AA at my current facility. So let me put that out there. They have AAs where I work, and the AAs I have shadowed are extremely happy working at that facility, and they have a lot of autonomy as AAs there. So I feel like I know for a fact that my director, works with the anesthesiologist department director. So I know, if I do a really great job, when I get a reference letter from her, or if they're in, once I'm done with school and I'm applying for that position, let's say I'm done with AA school, I come back and I'm applying at my same facility, I know I can use my director as the reference letter, and they're going to be like, oh, wow, I just sat with her in a meeting. I can just literally ask her, hey, Jolie applied for us. How was she when she worked for you? Right. So those are other opportunities and doors I think that were open for me, and I'm grateful for.
So I'm actually from a state that does not have AAs. I found out about the career just a few months ago, actually. So we have CRNAs. So how does an AA compare to a CRNA?
So from my understanding, they are linear. They just come from different backgrounds. So your CRNA is a nursing background, where an AA would possibly have, like, I don't know if they could have like no medical experience, but they may be a respiratory therapist like myself, or a paramedic, or a CNA, and did their bachelor's and then went to AA school. So where your guarantee of CRNA is going to was a nurse previous, like they have to take that pathway in order to become a CRNA. But other than that, in my mind, I have followed and worked with both of them closely. I think they're linear, to be honest. I think they're both going to be strong in some areas and weak in others. So if you have a CRNA who is a nurse, that individual is obviously going to be extremely strong in the medication area, right? In the pharmacology area. Versus if I were an AA, I might be stronger with intubations and placing A lines, but weaker with pharmacology, because I may not have that knowledge a nurse may have, right? Especially if it's a nurse who worked in the OR before, right? So they really got an upper hands on me. But I have a buddy actually who works in the OR. He's a paramedic, and he works kind of like as the anesthesiologist assistant. It's kind of cool. So, he has that pharmacology background. He has the OR experience. So if he goes up to be an AA, he's also got a great broad knowledge already going in there. So where I think that they definitely have their differences depending on their background, when it comes into practicing, they're linear.
That makes sense. Thanks for explaining that to everyone. So that pretty much sums up everything that I had to ask you. So where can people find you on social media?
So on social media, and I actually have it on my cute cup, I go by Pretty Jolie on pretty much everything. I think on Instagram it's Pretty Jolie _RRT. And then if you want to find me on Facebook, but I'm more active on Instagram, so I totally recommend finding me on Instagram. But Facebook is just I think it's just like Jolie Ann. So those are pretty much my social media platforms as of now, until I decide to branch out more.
So make sure everyone goes and follows her. Do you have any tips for any students?
Absolutely. And if I don't cover everything and you have questions for me and you're a student, please feel free to hit me up on Instagram and ask me anything. But for a broad tip spectrum, so I'm going to start out with when you're actually in the program and you're studying and it seems really difficult, especially when you hit that mechanical ventilation semester, just push through it. I always thought to myself, I knew RTs already, like, me and Austin now, so we could be your example. If we can do it, you can do it. So don't get discouraged. Just push through it. It's all worth it in the end if this is really what you want to do. I definitely recommend checking out Austin's videos. He always provides great study tips. You can always message either of us independently if you have questions. We are here to support you. We really want to encourage people to go this career path if you want to take care of people and make a difference. And then I would move on to once you graduate and you're picking that specialty, when you like where you want to work at, what field, like I really recommend digging deep and thinking about you as an individual before you choose that specialty. I personally right now work in oncology, and I just don't think that's for everybody. And it may not even be where you want to start out. So, see, are you really great with babies or working with kids, or do you want to work in OB and help deliver babies? Or, you're really like, I love children, but I'm not great as a practitioner or working with kids when they're sick. I'm better with adults, right? So just think about that and really dive deep when you're getting ready to apply to facilities so that you don't start out as a new grad in a specialty that freaks you out and kind of makes you wonder, did I do the right thing? Did I pick the right career path for me? And then last but not least, I want to just talk about once you are in your new facility and you are a new grad, your baby RT is what we like to call it. Just be confident in yourself and be confident in how hard you work to be where you are. Providers can be wrong, nurses can be wrong, so just make sure that you're confident in your knowledge and you always have the best interest for the patient, and always know your very first job is to advocate for patients, no matter what age they are, even if it's an adult patient, whatever the case. Just know we're here to advocate and give the best patient care that we can. So be confident in yourself and don't let people suppress you. And just know we're all here learning. Even if you have been a respiratory therapist for 20 years or you're a new grad, we're all here to learn together. So just remember that when you're going in and you're starting out in the facility.
All right, I just want to thank you for your time. Thank you for all your advice and just helping everyone. I hope everyone learned a little bit. If you guys have any questions, make sure you leave it in the comments below. Make sure you go check out Jolie on Instagram. Anyway, see you guys in the next one.